You found another edition of Optimal Anesthesia, the episode where we break down difficult concepts in the field of anesthesia. An intriguing topic awaits us today: the perioperative care of patients who are under the influence of MDMA, ecstasy. We're simplifying things for you by dividing it up into manageable chunks. First things first, let's establish some context. Ecstasy, or MDMA, is a club drug that combines stimulant and hallucinogenic effects. There are several names for it, including ecstasy, XTC, X, and Atom. Initially invented in 1914 as an appetite suppressant, the drug's potential as a psychotherapist was investigated in the following decades. However, misuse of the medication led to its classification as a Schedule I substance in the 1980s. Now, what exactly does MDMA do to a human body? It takes around 20 minutes for the full effects to set in, and they may persist for up to 8 hours. When people use drugs, they often feel euphoric, more attentive, emotional, and even sexually aroused. However, long-term usage is associated with decreased serotonin levels, a sped-up heart rate, weariness, lack of appetite, and possibly insanity. We've compiled a list of the adverse effects that can occur when someone takes MDMA. Let's break it down to make it more understandable. First up, we have musculoskeletal effects. MDMA can lead to rigidity, making your muscles feel tense. Bruxism, or teeth grinding, is also common. Ever wondered why people chew gum so much at raves? Now, rhabdomyolysis is a serious one. This is when your muscles break down, releasing harmful substances into your bloodstream and potentially causing kidney damage. This can show up as extremely elevated CPK levels in your blood. MDMA can play tricks on your heart too. It often leads to hypertension, meaning high blood pressure, and tachycardia, or a racing heart. Your heart ends up needing more oxygen, and this can sometimes lead to myocardial infarction, a heart attack. In rare cases, it can also cause cardiomyopathy, a condition where your heart muscle weakens. But don't be fooled, it can swing the other way too, causing hypotension and cardiovascular collapse. In severe cases, it triggers disseminated intravascular coagulation, a condition where your blood starts to clot abnormally throughout your body. The drug can send your metabolism into overdrive, leading to a hypermetabolic state. It messes with your body's electrolytes, often resulting in hyponatremia, low sodium levels, and hyperkalemia, high potassium levels. Both of these imbalances can be quite dangerous. On to the respiratory system. MDMA may cause pneumothorax, where air escapes into the space between your lungs and chest wall. Pneumomediastinum is another rare condition, involving air buildup around your heart and major blood vessels. It can even lead to respiratory depression, where your breathing slows down, posing serious risks. The kidneys aren't spared either. Acute renal failure can occur, which is when your kidneys suddenly lose their ability to filter waste from your blood. This can be life-threatening. The liver can take a hit, resulting in necrosis or steatohepatitis. In extreme cases, you might even face fulminant hepatic failure, a sudden and severe malfunction of your liver. Now, let's talk about the brain. MDMA is known for central thermogenesis, which means it can cause overheating in the brain. This leads to a range of neurological effects like hallucinations, feelings of derealization and depersonalization, heightened emotions, and anxiety. In some cases, seizures can occur, and even more rarely, it can trigger serious conditions like subarachnoid hemorrhage, cerebral infarction, and venous sinus thrombosis. How do we handle these patients in the operating room? We've got you covered from initial diagnosis to ongoing monitoring of vitals and correction of electrolyte imbalances and management of hemodynamic problems. So, what happens when an MDMA intoxicated patient enters the perioperative setting? We've compiled a set of guidelines, and we're going to dissect them to make it understandable. We often begin with a directed history and physical exam, but this might not be feasible in all cases. Most urine toxicology screens won't catch MDMA, so gathering information from friends, family, or bystanders can be crucial. Keep a close eye on vital signs, especially if the patient is overheating. If the patient is conscious and not at risk of aspiration, anxiolysis with midazolam or diazepam can be considered to raise the seizure threshold. However, steer clear of antipsychotics, as they can lower the seizure threshold. Now, during surgery, we must address hyperthermia, cardiovascular instability, electrolyte imbalances, and issues with the kidneys and liver. Core body temperature needs to be closely monitored to avoid severe complications. A rapid sequence induction is typically recommended for patients with severe intoxication. Different induction agents like propofol, thiopental, or even ketamine might be used based on the patient's cardiovascular status. Monitoring potassium levels is crucial before using succinylcholine, as these patients are at risk of hyperkalemia. If intraoperative hypertension and tachycardia require treatment, various options like labetalol, nitroprusside, or nitroglycerin can be considered. But remember, we should control reflex tachycardia with beta blockers. In cases of hypotension, rapid crystalloid infusions can be used to reach a presumed baseline pressure. Indirect agonists like ephedrine should be avoided to prevent potential complications. Treating hyperthermia is critical to avoid rhabdomyolysis and disseminated intravascular coagulation. Cold fluids and active cooling are essential measures. The use of dantrolene is a subject of debate, but it may offer some benefits. So, there you have it, a comprehensive guide to managing MDMA intoxicated patients in the perioperative setting. It's a complex task, but with the right approach and vigilant monitoring, it can be done safely. Thanks for joining us today on Optimal Anesthesia. If you found this episode informative, please share it with your colleagues and friends. Remember, knowledge is power in healthcare. Until next time, stay curious, stay informed, and keep making a difference in the world of medicine.